University Hospitals of Morecambe Bay, I want to welcome you and actually thank you for participating and coming and getting involved in shaping your maternity services for the future. What's really, really important is today we've got lots of people listening, and the people that are doing the talking are the people who use our services. So we have midwives here and they're hearing for themselves what's important to women. Once we've got all of that intelligence, then what we'll do is we'll use that to ensure that we're planning our services to address any improvements that we can make and actually to enhance any really good points that come across as well.
Since the very successful event in Barrow last year, we've gathered all of that information and used that alongside the patient experience surveys and the work that we're already doing with our maternity service liaison committees to help underpin the work that we're doing in relation to service improvement and development. And it's driven by the voice of the women and families in our community.
Gone are the days where we assume that we know what's right for our patients. Our patients need to lead and support us to get it right for them. And the only way that they can do that is by telling us their experiences, whether they're good experiences or poor experiences, so that we can get it right for them next time.
My issue really was the bedside manner of this consultant, because he made me cry, he made other patients cry, because he wasn't listening to the women really. But it was more to do with his attitude. It was more to do with the fact that my power had been taken away from me, and this particular consultant was not listening to me. If he had sat me down, like one of the other consultants had done at 6 weeks, and had listened to me and explained very gently, there's some really serious concerns going on here, I really advise you to do this, then I would have done it. I would have had a C-section earlier.
I have had 2 children with the Trust, the first in 2010, and that was quite a negative experience. I had my son in hospital. With my second child, I decided to have a home birth, and that was a much more positive experience. I had a wonderful midwife come to my home to deliver the baby, and she was excellent. She was really caring but also very professional, and we had a very, very positive experience.
Health Watch Lancashire is for, the voice of the people for people of Lancashire. So we basically go out, listen to people's views, capture the experiences regarding hospital or health or social care experiences. I think it's about showing people obviously that their views are being heard, and this is what the hospital, which is what the Trust is doing. For us, it's really good to be in the public eye as well, because we're here as an independent organisation and we're here to listen to their views, and if they want to share something with us on the day as well because they've not had a chance to share anything with the hospital, then they can talk to us.
We've actually are piloting something called the Always events, which is being piloted and conducted by NHS England. And that links in with the work that we've done in Barrow and what we're doing here today. Learning from women and families what's the one thing that they would always want to happen when they come into our services. And what's coming out is the stuff that came out both in Barrow, and I'm sure we'll hear today, about maintaining the same community midwife throughout their antenatal care, but also having their partners stay once they've given birth and be able to stay overnight and be part of that initial bonding, you know, in the first 24, 48 hours, as well as really good, robust, consistent support and advice for breastfeeding and feeding of their newborn baby and getting used to being a parent.
Well, I had my first child in the Trust 2 years ago, and I had quite a negative experience. There was a lack of communication between registrar and midwife, and the registrar didn't really treat me with as much dignity as maybe she should have done. I made a complaint after that. But then this time I've had a fantastic experience with Emily. I think the Trust has really improved. Certainly on the wards, the midwives all seemed a lot happier this time than they maybe did 2 years ago, and there seemed to be a better communication between the medical staff and the midwifery staff this time.
I've worked with the Maternity Services Liaison Committee for some years now, developing relationships with the professional care providers and encouraging service users to give feedback so that we can all together make the maternity service locally as good as it can possibly be.
We always want everybody to leave with a healthy baby and for them to be healthy as well. But what's really important is that along the way they've had a good experience as well, and that's what we're getting back from this. Recognising that we still do get it wrong, and that's why events like today are really important, and that we continue to have events like this, you know, years to come.
I guess sometimes people see people in the medical profession as being, you know, a bit separate, and that you have to listen to what they say to you. And I think in this day and age, with people learning so much on the internet and so on, I think it's quite good to have more of a two-way communication with health professionals. And I think days like this are great. You know, people are getting together and having a chat.
I think it's really important for everyone to get together, not only with the service users but across the different teams, so that people aren't working in silos, because I think that can happen as well, and that communication can get bad and solutions are better found all together, really.